Good morning, class. Now we will see our next chapter, that is ophthalmic preparations. In ophthalmic preparations, we will go through the introduction, formulation considerations of ophthalmic preparations, formulation of methods of preparation of labeling and containers of eye drops, eye ointments, and eye lotions, and lastly, evaluation of ophthalmic preparations. So ophthalmic preparations are defined as dedicated dosage form which are instilled onto the surface of the eye or administered inside the eye. So ophthalmic word indicates the dosage form which are used for the treatment of various conditions or various diseases or disorders related to the eye. So which type of ophthalmic preparations are generally used? So solutions, suspensions and ointments are the most commonly employed ophthalmic dosage forms. So solutions, suspension and ointments are generally used as a dosage form for treatment of various diseases related to the eyes. Then gels, gel forming solution, ocular inserts, intravitreal injections and implants are some of the newest dosage forms used for ophthalmic delivery. Now, along with the conventional dosage forms like solution, suspension and ointments, gels, gel forming solutions. Gels, as you know that gels are having semi-solid consistency. Gel forming solutions. So gel forming solutions are the solutions which are initially in a solution form, but when they come in contact with eye, they get converted into gel form, and this may occur due to various polymers which solidify or which get converted into gel form when they come in contact with various types of ions or when the temperature is elevated. So initially these are the solution form, but when they come in contact with eye, they turn into gel form. Now gel forming solutions are generally useful to avoid precorneal drainage of dosage form. Ocular inserts. So ocular inserts are the inserts which are inserted into eyes, and intravitreal injection and implants are the some of the newest dosage form. Various categories of drugs are used in the treatment of various disorders of the eye, which include myotics, mydriatics, cycloplegics, anti-inflammatories, anti-infectives, anti-glaucoma drugs, then diagnostic drugs and anesthetics. So these all category of drugs are used for the treatment of various kinds of disorders which are related to the eye. Now next, what are the ideal requirements of ophthalmic product? So the ophthalmic product should be clear and free from foreign particles, fibers and filaments, as this ophthalmic product will be instilled into the eye. So to avoid irritation of the eye, to avoid inflammation of the eye, to avoid any injury to the eye, this ophthalmic product should be free from any foreign particles, fibers and filaments. The second, ophthalmic product should be isotonic with lacrimal secretion to avoid discomfort and irritation. Now all you know that what mean by isotonic. So isotonic solutions are having same osmotic pressure as that of eye uh, secretions or eye. If the product is not isotonic, then there are chances, or not chances, but definitely there will be irritation of the eye and redness of eye will occur. Hence, these ophthalmic products are made isotonic with eye fluids. So third one is a pH is an important parameter for ophthalmic products. So pH of ophthalmic product should be optimum. Then ophthalmic preparations must be sterile when prepared. Now this one is the important criteria, that ophthalmic product must be sterile when prepared, as we all know that injectables or parental products are sterile in nature. Likewise, ophthalmic product should be sterile in nature. Why should be sterile in nature? Because eye is very delicate organ. Eye is very delicate organ, and if any microbial infection occurs to the eye, then that person may lose the sight, may lose the vision, and to avoid further complications, the ophthalmic product should be free from microorganism. That means this ophthalmic product should be sterile. Next one, vehicles used in ophthalmic preparation must have good wetting ability to penetrate cornea and other tissues. Now what happens generally? You are going to instill the ophthalmic dosage form into the eye, and if that ophthalmic dosage form is not having good wetting ability, then the dosage form after instilling into the eye will get simply rolled over the eye and will come uh, out of cornea and will not show its effect, and hence that ophthalmic preparation should have good wetting ability so that after instilling into the eye it will wet or it will spread over the cornea and other tissues. And lastly, important one, that ophthalmic preparation should not cause damage to the tissue of eye. If ophthalmic preparation is having any particulate contamination, if ophthalmic preparation is non-sterile, if pH of the ophthalmic preparation is not matching with the pH of the eye, then there are chances of damage to the tissues of the eyes. Next one is the formulation consideration. So ophthalmic preparations must be sterile and free from foreign particles, fibers and filaments. A material, in-process intermediates and a drug substance are the sources of contamination. Most ophthalmic products are sterilized by aseptic filtration. So first of all, first consideration is that you have to choose the raw material very carefully. That raw material should be should may act as a source of contamination. So a due attendance should be given to the for choosing a raw material. Next, ophthalmic products should be isotonic with lacrimal secretions to avoid discomfort and irritation. When the tonicity of ophthalmic solution is equal to 0.9% weight by volume sodium chloride solution, then it will be isotonic. So as we all know that the 0.9% weight by volume sodium chloride solution will be isotonic with the eye secretions or lacrimal secretions. The eye can tolerate a range of tonicity from 0.5 to 2% NaCl. Okay, now this is this point. Consider this point while formulating eye preparations. So I can tolerate tonicity of 0.5 to 2% sodium chloride, but optimal tonicity should be 0.9% weight by volume of sodium chloride solution. There are various isotonic vehicles which are used to prepare ophthalmic products like 1.9% weight by volume boric acid, sodium acid phosphate buffers. Third one, to prolong the contact time of the drug in the eye. Now one of the disadvantage or one of the drawback, we can say drawback instead of disadvantage, one of the drawback associated with the ophthalmic product is that when that ophthalmic product is instilled into the eye, the drainage of that product from the eye is very fast. Okay, the product did not remain in contact with the cornea or in contact with the eye surface for a long period of time. With the blink of the eye, more and more product comes out of the eye, and as more and more product comes out of the eye, the pharmacological effect is not very that much as we wanted. Hence we need to formulate or we need to make changes into the formulation such that the product will remain in contact with the eye more and more time. Hence, in order to prolong the contact time of the drug into the eye, various thickening agents are added in ophthalmic preparations. Now, if your ophthalmic product will be thick enough, then because of thickness, that product will not get drained from the eye, and hence thickening agents are generally added. Some of the examples of thickening agents are polyvinyl alcohol 1 to 4%, then polyethylene glycol, methyl cellulose, CMC, that is carboxymethyl cellulose. These agents enhance the viscosity of the preparation. An ideal thickening agent should be easy to filter, easy to sterilize, compatible with other ingredients. Okay, so ideal thickening agent should have all these properties. Then pears have pH of about 7.4. The pH has major role in therapeutic activity, solubility and stability and comfort to the patient. The eye can tolerate a solution with wide range of pH, but they should not be strongly buffered. So the ideal pH should be of ophthalmic preparation should be in between 6 to 7 we can say 6 to 8 we can say that. So vehicles used in ophthalmic preparations must have good weighting ability. This property increases the penetration into the cornea and other tissues. Hence, surfactants are added in ophthalmic products. Then ocular irritation studies need to be performed to ensure that API and other additives do not cause any discomfort to the eye. Then formulation methods of preparation, labeling of the containers of first of all formulation eye drops. So ophthalmic drops or eye drops. Now ophthalmic drops, which are also called as eye drops, are the most commonly used ophthalmic preparations. Are the most commonly used ophthalmic preparation eye drops. So in treatment of various kind of conditions, eye drops are prescribed. Eye drops are basically solution, suspension or emulsion. Solution, suspension or emulsion. And these eye drops are instilled into the conjunctival sac and are sterile, aqueous or oily solutions. Eye drops might be either aqueous in nature or oily in nature. Eye drops might be solutions or suspensions or emulsions. When examined under suitable conditions of visibility, ophthalmic drops should be clear and practically free from particles. So, any kind of particulate contamination should not be there in ophthalmic product. In the production of aqueous ophthalmic preparations, water for injection as per pharmacopoeia limits is used. So we have seen that what is water for injection, what is sterile water for injection in injectable products. So for preparation of ophthalmic solutions, or we can say that ophthalmic preparations or ophthalmic eye drops, water for injection is used as a vehicle, and that water for injection should meet the pharmacopoeial limits. Isotonic agents, buffering agents, pH adjusting agents, antimicrobial agents, antioxidant, viscosity increasing agents are the some important considerations or the some important excipients which are added for the formulation of ophthalmic preparations and with appropriate packaging. Now, which are the excipients which are generally added for the formulation of eye drops? So, isotonic agents, as already discussed, isotonic agents are used to maintain the osmotic pressure as that of the eye. Then buffering agents and pH adjusting agents are used. So buffering agents are basically used to resist the change in pH, and pH adjusting agents are generally used to adjust the pH of the preparation or ophthalmic eye drops. Then antimicrobial agent. So antimicrobial agents are basically added to prevent the growth of microorganism inside the eye solution or eye drops. Then antioxidants. Then viscosity increasing agents. Viscosity increasing agents are again, as we have discussed, are added for the increasing the viscosity so that more amount of time the preparation will remain in contact with eye surface. And packaging is also important. Now packaging is important consideration for both for storage of uh, product, for increasing the stability of product, as well as it should be useful for delivery of contents into the eye. So it should be useful from the patient point of view also. Ideal eye drop properties. So what should be the ideal eye drop properties? Now these ideal eye drop properties are same as that of ideal properties of any ophthalmic preparation. What are that properties now? That eye drop should be sterile, should be isotonic, should have pH as that of eye, should be free from microorganism, should be free from any particulate matter, should have suitable preservative, and should have suitable preservative. Now following are the some components which are generally used for the or excipients which are generally used for the preparation of eye drops. So tonicity adjusting agents. The tonicity of ophthalmic solution should be adjusted correctly. Exert a osmotic pressure equal to that of tear fluids, which is generally equal to 0.9% weight by volume of sodium chloride. So ophthalmic solution should have tonicity between 0.5 to 2% NaCl equivalency and should not cause a marked pain, and range about 0.2 to 0.7 should be acceptable for most person. Okay, so 0.9% weight by volume sodium chloride type equivalent isotonicity osmotic pressure should be maintained. And for maintaining the isotonicity or for adjusting the tonicity of the ophthalmic preparations, various tonicity adjusting agents like sodium chloride, potassium chloride, buffer salt, dextrose, glycerin, propylene glycol and mannitol are used. Next is buffers. So pH adjustment is very important as to consider the formulation more stable to enhance the drug bioavailability, to enhance aqueous solubility of the drug, to maximize preservative efficacy. So for all these purposes, buffers are required. Ideally, every product buffered to a pH of 7.4, which is a normal physiological fluid pH of tear fluid. Example of buffers used are boric acid vehicle, isotonic phosphate vehicles. Then surfactants. So surfactants are used basically for to increase wetting ability of solution. The order of surfactant toxicity is anionic is more toxic than cationic is more toxic than non-ionic. There are several non-ionic surfactants which are used in low concentration to add in a dispersing steroid in suspensions and to achieve or to improve solution clarity. So basically for increasing the wetting property, for increasing dispersion of the solution over the surface of the eye, surfactants are used. Some of the surfactants which are principally used are sorbitol ether esters of oleic acid, which are also called as a polysorbate or twin 20. Then stabilizers and antioxidants. Stabilizers are the ingredients which are two preparations to decrease the rate of decomposition of active ingredients which are used to, so stabilizers are the ingredients which are used to decrease the rate of decomposition of active ingredient. Antioxidants are the principal stabilizers added to some ophthalmic preparation, primarily those containing epinephrine and other oxidizable drugs. Example, sodium bisulfite or metabisulfites are used in concentration up to 0.3%. Then next is viscosity imparting agents. So obviously to increase the viscosity of your preparation, viscosity imparting agents are used. So some of the viscosity imparting agents are polyvinyl alcohol, methyl cellulose, hydroxypropyl methyl cellulose, also what is HPMC, hydroxyethyl cellulose and carbomers, which are generally used for increasing the viscosity of ophthalmic preparations. They increase the ocular contact time. Okay, why there is a need to increase the viscosity? Because obviously they will increase the contact time between the your product and eye. Decrease the drainage rate. So the solutions are basically drained fast, and if these solutions are highly viscous, then drainage will be slow. Increase the mucoadhesiveness and increase bioavailability. Now all these will lead to the increase in bioavailability of a drug. Then vehicles. In ophthalmic preparation, generally purified water USP is used as a solvent which may be obtained by reverse osmosis, deionization and distillation process. Some of the mineral oil, vegetable oil such as sesame oil, castor oil which have highest purity are used in extemporaneous compounding. Then preservatives. So preservatives are generally added to stop the microbial growth. So general preservative which is used most of the times in ophthalmic preparation is benzalkonium chloride or benzothonium chloride. Next, preparation of eye drops. So eye drops are basically solutions, emulsions or suspensions. So the preparation method, basic preparation method is same as that of other suspensions, other emulsions and other solutions. So for preparation of solution, so all the ingredients are weighed correctly and added into suitable vehicle, and that all ingredients should be soluble in that suitable ingredient. And again active ingredient is added and final volume is made. Then clarification. So to remove any kind of particulate contamination from the product, okay, to remove any kind of particulate contamination from the product, that product or the solution is filtered. And generally, by use of sintered glass filter, membrane filter, clarification of solution is carried out. Clarified solution is then filled into the final container, sealed and sterilized. Then sterilization by using autoclave at 115 degrees Celsius for 30 minutes or 121 degrees Celsius for 15 minutes, or by membrane filter having pore size 0.22 micrometer into sterile containers using a strict aseptic condition, that is grade A laminar air flow conditions, or by dry heat sterilization on 160 degrees Celsius for 2 hours for non-aqueous preparation, that is liquid paraffin eye drops. So there are number of methods which are used for the sterilization of product like autoclave, hot air oven or membrane filtration sterilization. Then labeling of the container. The following information should be mentioned on the label clearly. So what should be the information which should be maintained on the label, mentioned on the label clearly? So this information is generally present on each and every label of different pharmaceutical product. So what are the points should be maintained mentioned on the label? So the product name and strength, obviously if there is a eye drop, then eye drop name of that eye drop or the API component along with its strength percentage. Then antimicrobial agent used along with its concentration, manufacturing date, expiry date, batch number, license number, and one more important thing which should be present on the label, that this product is for external use only. This product is used for external use only. Any other indications like discard if any visible particles are observed, and complete address of manufacturer. If any visible particulate contamination is observed, then it is advised to discard the whole formulation. Then containers which are used for the preparation or for the containers which are used for the packaging of eye preparations are, so suitable multi-dose containers are generally used. So containers which are used in the packaging of ophthalmic products are generally multi-dose containers. So suitable multi-dose containers are used for supply of ophthalmic drops that allow successive drops of the preparation to be administered. So when a patient purchases a ophthalmic solution or ophthalmic ointment suspension, so these are not for single use. Okay, uh, single use are there, but they come in capsule form. But when they are in a solution form, multi-dose containers are generally used, and patient instill again and again uh, solution from that multi-dose containers into the eye. The container should be fitted with tamper-evident device. The maximum volume of the preparation in such a container should not be more than 10 ml. So generally 10 ml product or 10 ml solution is generally filled inside the container. But whenever necessary and wherever there is a prescribed or where there is a permitted, more than 10 ml solution can be filled inside the container. Once the container is initially opened, multi-dose ophthalmic preparation may be used up to 4 weeks. Now, 4 weeks are the maximum period for which multi-dose containers can be used once they are open. Droppers supplied separately should also comply with the test for sterility. So the droppers which are provided with ophthalmic product along with the container should also be sterile. Ophthalmic drops may also be provided in suitable single dose containers. Okay, suitable single dose containers can also be used. Antimicrobial agents should not be present in single dose containers for single use. Now these are the some this is the typical eye drop container. Here is a dropper is present is there. Then eye ointments. Ointments are semi-solid preparations meant for external application in the skin or mucous membrane. They generally contain medicament or medicaments dissolved, suspended or emulsified in an ointment base. Eye ointment is the sterile preparation meant for application to the eye. They are prepared aseptically, incorporating the sterile medicament into a sterile base. So basically, eye ointments are prepared by incorporating a API, that is our active pharmaceutical ingredient, into the sterile base. Sterile ointment base. Eye ointment is primarily anhydrous and the base consists of mineral oil and white petroleum. This can be varied in proportions to adjust consistency and melting point. There are two methods for incorporating the medicaments. Aseptic conditions must be observed throughout. So while preparing any kind of ophthalmic product, aseptic condition should be maintained. So water soluble medicament and insoluble medicament. So if there are water soluble medicament, then medicament is dissolved in minimum volume of purified water, and then the solution is then sterilized by autoclaving or filtration and slowly incorporated in the previously melted sterile base, which is stirred until cold. And insoluble medicaments, so insoluble medicament is finely powdered and triturated with small quantity of melted previously sterilized base. So trituration method is carried out. The mixture is then incorporated with the remainder of the melted base, and the ointment based base must be non-irritant and to permit the diffusion of the drug through the lacrimal secretion of the eye ointment. Base should be near to the body temperature. So the base should be adjusted so that its melting point is near the body temperature. For preparation of eye ointment, bases like yellow soft paraffin, liquid paraffin and wool fat are used. So for preparation of eye ointment base, yellow soft paraffin, liquid paraffin and wool fat are used. White soft paraffin is not used because it is prepared by bleaching the yellow soft paraffin. So bleaching process may cause irritation of the eye. Hence, generally yellow paraffin is used. Some of the bleaching agents may lead to irritation which may remain sticking to the base even after careful washing, which when used in the eye. So because of irritation, bleaching agents are avoided. Wool fat is used to ensure specific emulsification of the solution and help in absorption of active ingredient. Liquid paraffin is used to reduce the viscosity of base so that it can be easily expressed from the collapsible tube and applied to the eye. So again here uh, formulation consideration is that formulation should be easily expelled out of the container. If the viscosity of formulation is very high, then it might be difficult to expel the product from the your container tubes. Hence, to adjust the viscosity, liquid paraffin is generally added. This is the one of the example of eye ointment. So it is a neomycin, polydimycin, bisulfate, bacitracin, zinc, and hydrocortisone ophthalmic ointment (USP). Then containers which are used for ophthalmic ointments are so collapsible metal, aluminum or plastic polyvinyl chloride. So aluminum or polyvinyl chloride collapsible tubes or single dose containers are used for packaging of eye ointment. Before use, collapsible metal tubes should be freed from dust and metal particles. So care must be taken that collapsible metal tubes should not shed any kind of metal particle inside the product, and hence before the actual filling is carried out, the tubes are made free from any kind of metal particulate contamination. This is probably the best achieved by blowing the tubes out with the powerful jet of filtered dust-free air. So to remove any in order to remove any particle contamination, so high pressurized air is blown through the tubes so that any particulate matter will be removed. Certain proprietary formulation of eye ointments are available in single dose containers. तुम्ही बघितलेले असतील single dose container eye ointment चे पण. These take the form of an elongated, flexible gelatin capsule with one end constricted and other and are opened by cutting off the constricted end with sterile scissors. The container of eye ointment, which are not extemporaneously dispensed, should be enclosed in tamper-proof packaging to indicate that it has not previously been opened. So tamper-proof packing should be there. Then label claims keep out of the reach of the children, store away from direct heat and light in a cool dry place. Why to store away from the heat and cool and dry place? Because it is ointment, and as we have seen that the base melting point should be near to the body temperature, and if we are going to store this ointment in a hot place, or in contact with direct sunlight, then there are chances of melting of the bases and base separation, or bases which are used for the material which is used for the preparation of base might get separated, and consistency of the product might be lost, stability of the product might be lost. Hence, in order to avoid this complication, there should be clear-cut indication on the ointment container that store in cool and dry place. Refrigeration is not necessary unless otherwise specified on the label. Then eye lotions. Eye lotions are used for first aid purposes in undiluted form, used for an eye bath. So whenever there is any kind of injury to the eye, so for washing purpose, eye lotions are used. For cleansing purpose, large volume of fluid is flowed quickly over the eye. As lotions cause much greater dilution of the lacrimal fluid, hence it should be isosmotic to tears to avoid any discomfort. As usual, any kind of ophthalmic product should be isosmotic, isotonic, or iso pH. Sterile normal saline is example of most common eye lotion. Eye lotion is supplied in a concentrated form and before use diluted with warm water. It can be stored for 2 days, but after that it needs to be discarded. Eye lotion generally not contain any drug, but it contain vehicle along with isosmotic agents. So the basic purpose behind eye lotion formulation is that these eye lotions are generally used for washing of the eye. If any kind of injury occurs to the eye, if any kind of irritant goes into the eye, if any kind of liquid which is not which is harmful for the eye goes inside the liquid, at that time washing of eye is recommended, and for the washing of the eyes, eye lotions are generally prescribed. Now remember that eye lotions does not contain any kind of active pharmaceutical ingredient, but these eye lotions only have isosmotic solution along with vehicle. Okay, so they do not contain any kind of active pharmaceutical ingredient. Here is the difference between eye drop and eye lotion. So eye drops are less amount is used. Eye lotion used in large volume to mechanically remove the foreign material. वॉशिंग पर्पज साठी लागणार आहे, त्याच्यामुळे आय लोशनची क्वांटिटी जास्त राहणार. नाउ इन आय ड्रॉप मेडिकामेंट इज नेसेसरी. In eye lotions, medicament is not necessary. In eye drop, isotonicity is not essential. But in eye lotions, as it is used in a large volume, eye lotion should be isotonic. Eye drops are used for treatment of any kind of infection as it contains API. But as usual, eye lotion does not contain API, so it is not generally used for the treatment of eye diseases. In case of eye lotion, dilution is not necessary, but in case of in case of eye drop, dilution is not necessary, but in case of eye lotion, dilution is necessary. This is domiciliary use should be discarded in 4 weeks after first opening, but in hospital wards should be discarded 1 week after opening. So domiciliary use means, so eye drops are generally used household use. Okay, and these are generally once opened inside the by the patient at his or her home, then that should be used within a 4 weeks, and if it is meant to be stored more than 4 weeks, then it should be discarded. And if same eye drop is used in the hospital, then that hospital crew should discard the uh, eye drop within 1 week after its opening. And eye lotion is generally used inside the hospitals by the physicians for the removing of the extra any kind of particulate matter from the eye, and should be discarded within 24 hours. Then containers. Amber colored screw capped fluted bottles are used for to pack the eye lotion. The containers are labeled as for external use only. Then next point and last point, evaluation of ophthalmic products. So following tests are used for the evaluation of ophthalmic products. So various kinds of tests are used for the evaluation of ophthalmic product. So sterility test, clarity test, liquor test, and metal particles in ophthalmic ointment. So sterility test, the ingredients that meet the sterility requirement described should be used. The container for ophthalmic preparation should also be sterile at the time of filling and closing. Ophthalmic solid should not contain anaerobic, aerobic bacteria and fungi. Sterility tests are therefore performed by the first membrane filtration technique. So a 1% solution of ophthalmic product 1% solution of ophthalmic product is prepared in isopropyl myristate and filtered cellulose nitrate filter paper with pore size less than 0.45 micrometer. By using 100 ml quantities of sterile diluting and rinsing fluid, the membrane is washed 3 times and transferred aseptically into fluid thioglycolate and soybean casein digest media. FTG stands for fluid thioglycolate media and soybean casein digest media SBCD. Incubation of membrane is carried out for not less than 14 days. If there is any growth on FTG medium, it indicates the presence of anaerobic and aerobic bacteria, and growth on soybean casein digest medium indicates fungi and aerobic bacteria presence. If no visible growth in both these media occur, then it indicates the sterility of product. So what is the procedure? So you have to filter the solution through the cellulose nitrate filter paper, which is having pore size not less than 0.45 micrometer. Then you have to incubate this filter paper in the FTG, that is fluid thioglycolate media, and SPCD, that is soybean casein digest media. And after 14, not less than 14 days, there should be not any visible growth, which indicates the sterility of product. If there is any visible growth, then product is not sterile. Then next is a direct inoculation technique. So in this technique, by use of an emulsifying agent, one part of the product is diluted with 10 parts of the sterile diluting and rinsing fluid, and it is incubated in thioglycolate and soybean casein digest medium for 14 days. No growth indicates sterility of the product. The next evaluation test is uniformity of dosage form. This test is performed on a single unit containers. Uniformity of dosage includes checking uniformity of the content as well as checking uniformity of mass of the dosage form. So each dose should contain uniform amount of API. Then clarity test. So ophthalmic solution should be free from foreign particles. This is done by visual inspection under proper light or by instruments such as light scattering or video image projection. So clarity test is basically, as name indicates, is carried out to check any kind of presence of any kind of foreign particles, and clarity test should be passed. The leakage test. So leakage test is carried out to evaluate if there is any kind of leakage in the product container. To evaluate the inactness of the ointment tube and its seal, this test is performed. In this test, 10 sealed containers are selected and their exterior surfaces are cleaned. For 8 hours at 60 plus minus 3 degrees Celsius, these tubes are placed horizontally over adsorbent blotting paper in an oven. If any stain is not observed over blotting paper, then test is said to be passed. If any kind of leakage is observed, then test is repeated with additional 20 tubes. The test passes if not more than one tube shows leakage out of 30 tubes. So what is the exact procedure carried out? So exterior aluminum tubes जो surface असेल त्याला clean करायचं. After cleaning that surface, these tubes are kept for 8 hours at 60 plus minus 3 degrees Celsius in an horizontal position over a blotting paper. And if there is any leakage, the melted bases will come out of that leakage and will produce a stain on a blotting paper. And if any kind of stain is observed, then we can say that leakage test fails. Okay, and no leakage, stain on adsorbent blotting paper indicates passing of leakage test. So out of 20, if any kind of leakage is observed in one tube, Then again test should be repeated on 30 tubes, and out of 30 only one tube is allowed to be leakage. If more than one tube is have leakage, then test fails. Then presence of metal particles. This test is required only for ophthalmic ointments. The presence of metal particles will irritate the corneal or conjunctival surface of the eye. It is performed using 10 ointment tubes. So 60 millimeter diameter clean petri dish having flat bottom is used for this test. So petri plate is used for this test. The content from each tube is fully withdrawn into petri dish. The product is heated at 85 degrees Celsius for 2 hours while the lid is closed. Then product is cooled at room temperature once it is melted and distributed uniformly. After solidification, remove the lid. The bottom surface is then viewed through an optical microscope at 30 times magnification. For illumination of viewing surface, an external light source positioned at 45 degree angle, not Celsius, I'm sorry, 45 degree angle is positioned on the top. The number of particles for 50 micrometer or above is counted using a calibrated eyepiece micrometer by examination of entire bottom surface of the ointment. According to USP, the number of such particles in 10 tubes should not be more than 50, with not more than 88 particles in any individual tube. Then resuspendibility, redispersibility test. Suspension should be physically stable. If the particles settle and eventually produce a cake at the bottom of the container, then they must be redispersed easily upon shaking. Last one is viscosity. An increase in viscosity increases the residence time in the eye. However, drug diffusion out of the formulation into the eye must be inhibited due to the high product viscosity. Upon generally we can say that viscosity should be more, but viscosity should not be such more that it will stop the diffusion or release of the API through it. Hence viscosity should be optimum, and generally viscosity is measured by using various viscometers like rotational viscometer, falling ball viscometer. Okay, so different viscometers are used for checking viscosity of the product. So these were the general tests which are used for testing ophthalmic product. So here was about ophthalmic product. Thank you.